This stretch is called Happy Baby stretch. It's really to open out the inner groins, stretch the back of the hamstring, the glutes, and the front of the opposite hip. So you're going to be lying supine on your back, 2 straight legs. And then from here, you're going to bring the knee in towards the chest. Now you're going to take the same hand as the leg and just hold on from the inside of the leg onto the sole of the foot, okay? So just holding on to the sole of the foot. I'm going to keep my other hand on top of the opposite thigh. And what I want to do is just apply pressure downwards with my hand onto the sole of the foot so that this knee comes towards the floor, okay? So you're just holding on to here and I'm gently pressing down to try to get my knee towards the floor. So what I'm feeling is a pull and a little stretch at the front of the hip flexor on the opposite side. And on this side, I'm feeling a little bit of the hamstring and the glute and the inner groin on the side of the leg that I'm moving. And then gently release. So it's really opening out around the hip sockets here as well. Now if somebody's really tight around the hip flexors and hip socket, they might not be able to reach their foot, in which case you can use something like a yoga strap to put around the back of their foot and they can hold onto the strap as an alternative version. So we're just going to show you this from the back view. So Jasmine's lying on her back and she just brings that leg in towards the chest and her hand goes on the inside of the thigh, holding onto the sole of the foot. Now we want the knee and the ankle to be in a line so that the foot isn't here. So the foot and heel want to be directly above that knee. So gently she's pushing pressure down and opening out the front of the opposite hip, but the back of this leg, glute, hamstring and inner groin. Can you feel that there, Jasmine?
Yeah.
Good. And then gently release. Now I'm going to try that with the other leg and I'll just do a couple of hand holds. So I'm just going to move to the other side. So just gently. So I can hold on to the sole of the foot like this with my hand, and with my other hand I'm not holding onto the knee joint because you don't want to hold onto the joint itself, but I'm just pressing onto the quad just above the knee to prevent this knee from bending and to prevent the foot from coming off. If this knee bends or this foot comes off, it's just a sign that the hip flexors on this side are a little tight. So I'm just going to keep this hand there and gently breathing in and exhale, just gently pressure down. How does that feel there, Jasmine?
Yeah. Good.
Is that enough?
Yeah.
Yeah. And then gently release. So again, if you're going to apply stretches and increase stretches, you've got to ask permission first and then always getting feedback. Just really slowly move into it. Don't move too quickly, too far. Otherwise you might injure somebody.